Ehlers-Danlos Syndrome is a genetic disorder of which there are 13 variants. It affects the connective tissues of the body, and depending on the type, this effect can be milder or more severe. Most people with EDS have hypermobile EDS, which means their joints have a greater range of motion than is normal, and their skin is very loose and stretchy. Evie Oddly, a well-known drag performer with this type, is pictured showing off the way EDS has affected the skin at the top of his head.
As previously mentioned, the three most common forms of EDS are hypermobile, classical, and vascular. The 10 other types of Ehlers-Danlos syndrome include the following. Ehlers-Danlos syndrome is a group of disorders that affects the connective tissues that support the skin, bones, and blood vessels. An exceptionally wide range of joint movement is displayed in most forms of Ehlers-Danlos syndrome. This is a distinct feature of the hypermobile type. Children with hypermobility often have weaker muscles, which can hinder the development of their motor skills, such as walking, standing, and sitting.
Pathophysiology is defined as the study of effects of diseases on physiological processes. The pathophysiology of most EDS subtypes involves heritable mutation in collagen synthesis and processing. EDS is inherited and can be passed down from parent to child. Inheritance pattern of mutations vary, but include dominant and recessive inheritance with distinct mutation. In a dominant inheritance pattern, one copy of a genetic variant is needed to inherit the condition. In a recessive inheritance pattern, 2 copies of the genetic variant, one from each parent, is needed to have the condition.
Ehlers-Danlos syndrome is caused by a collagen deficiency. Collagen is a protein in the body that adds flexibility and strength to connective tissue and is responsible for joint health and skin elasticity. People with EDS have a faulty gene that leads to weaker collagen or insufficient normal collagen in their tissues. These defects can hinder the connective tissue's potential to support muscles, organs, and other tissues. Because the collagen impacted by these mutations is essential to every physiological system, EDS symptoms can vary between individuals. The many types of Ehlers-Danlos syndrome are associated with various genetic causes, some of which are inherited and passed down from parent to child. If someone has the most prevalent type, hypermobile EDS, there is a 50% chance that they will pass on the gene to each of their children.
Each type of EDS has its own set of criteria that doctors follow to determine a diagnosis of EDS. Some of the indications for an EDS diagnosis include fragile or stretchy skin, loose joints, severe tiredness, and a family history of EDS. Currently, there is no genetic test available for the most common form of EDS, and because of this, people with this type are more likely to be misdiagnosed due to an overlap of symptoms with other conditions such as fibromyalgia or chronic fatigue.
Each type of EDS and each individual have different symptoms and characteristics. Some of the most common symptoms include joint hypermobility, loose and unstable joints, joint pain and clicking joints, and easily bruised skin. Some neurological manifestations include, but are not limited to, developmental delay, hypotonia meaning low muscle tone, insomnia, and chronic fatigue. Continuing discussing clinical manifestations, some common musculoskeletal manifestations include subluxations, meaning a partial dislocation within the body typically occurring in a joint, dislocations, persistent pain, and recurrent fractures.
The approaches in Ehlers-Danlos syndrome are holistic and focus on the signs, symptoms, and complications of the patients. Occupational therapy is the most effective option in managing pain in people with EDS. Its benefits play a role in improving joint stability, although it should be used with caution as it can cause muscle weakness. Physical therapy addresses pain from a psychological and physical perspective. It has an underlying weakness of patient fear of pain due to movement, and patients should be educated on their disease and cautioned against overstretching. Surgery and procedures can be helpful for other joint pathologies, however, it's generally not recommended for the EDS population due to poor pain relief and post-surgical complications. Opioids and opioid-like medications are popular pain reliever options, although they have side effects and can be risky in people with EDS. Muscle relaxants are also an effective form of treatment to aid in muscle-related pain, but they can worsen joint stability and are susceptible to addiction. Complementary and alternative treatments are considered by people with EDS because of the perceived safety. Treatments such as chiropractic manipulation should be considered when other types of stretching or therapy is warned against. Steroids play a role that is prominent by decreasing inflammation to ease pain. They should be cautioned, especially in this population because of the side effects of impaired wound healing. Non-steroidal anti-inflammatory drugs are medications that are used to reduce inflammation-related pain. They should be used with caution to avoid side effects and the aggravation to cell symptoms. Psychotherapy techniques such as cognitive behavioral therapy require thorough evaluation by a psychologist and psychiatrist prior to initiation. Some myths that have been debunked revolving around Ehlers-Danlos syndrome are: Ehlers-Danlos syndrome is not painful. This is not true, as the pain scale can range from mild to severe. Ehlers-Danlos syndrome is a hereditary illness. A person can also become a patient of EDS without having any familial roots. Ehlers-Danlos syndrome happens in people with a specific type of body. It is thought that this syndrome happens in people who are thin. This is a myth because it is not confined to a specific type of body or ethnicity. Patients with Ehlers-Danlos syndrome will always have stretchy skin. The condition of skin with EDS depends on your skin type and what form of the disease you have. Young patients cannot have pain. Young people can often experience higher levels of pain intensity than adults. When others disregard the pain of patients, it can be damaging for their mental health. There are no treatments for Ehlers-Danlos syndrome. While it is true that there is no permanent cure for EDS, there are many treatments that are available for controlling the symptoms.
My name is Elliot. I am 16 and diagnosed with hypermobile Ehlers-Danlos syndrome when I was 10 years old. I have had hypermobile joints since birth. Ehlers-Danlos syndrome impacts my everyday life. I struggle with constantly being tired, and I live in muscle and joint pain every day. I went to the EDS clinic at Sick Kids in Toronto, where I have received plenty of supports. I have gone to physiotherapy, occupational therapy, chiropractic therapy, as well as cognitive behavioral therapy to support my anxiety. When I was younger, I used a wheelchair when I knew there was going to be a lot of walking. I also had a leg brace to support my walking in school. I have used a laptop since almost grade 2, where basically I have not almost touched a pencil since, because I'm unable to handwrite due to having EDS, and always having access to a laptop is quite nice. With all the supports, I've grown physically stronger, but I still require accommodations at school and work. It is not a disease that is noticeable. It is very hidden and uncommon. It is hard to find supports that understand this disease, and I hope that there becomes more awareness and knowledge about how it impacts people like myself for their everyday life.
Children with EDS experience symptoms that affect their everyday life, including school. They will need support and accommodations in school to reach their fullest potential. Communication between educators and the family is important to understand what best supports the individual child. An individual education plan can be developed to outline resources, services, and supports the child with EDS will need, and what accommodations they will need to be most successful. Some accommodations children with EDS need are rest periods to reduce fatigue, assistance with note-taking and extended time for tests and assignments, access to technology, alternate physical activity classes that do not include high-impact activities that could risk dislocation of a joint. Educators should aim to assure that children with EDS can live a normal life as possible and feel welcome in their school environment without feeling labeled different from their peers.
There is a well-known saying within the medical community that if you hear hoofbeats, think horses, not zebras. This is because more often than not, a person's diagnosis will be something common rather than rare. However, this can be very limiting when anyone with a rare condition is trying to find answers and their doctors are only on the lookout for a horse. This is why people with EDS consider themselves the zebras of the medical community due to the rarity of the disorder. So when you hear hoofbeats, sometimes it really is a zebra.